Dr. Service, how has the development of a more diverse group of psychotropic medications, or FDA approval of medications for various psychiatric diagnoses over the past 20 years impacted the training of psychiatrists?
Well, actually, it's very exciting, but at the same time, it's very challenging to have so many more psychotropic medications available for the treatment of patients. When I trained as a resident, it was so long ago that we had a relatively small group of medications to choose from, and most of the medications that I used at that time are no longer frequently used. Just as examples, I mean, I trained before the era of atypical antipsychotic medications. They didn't exist. Prozac was the new antidepressant. It was, of course, the first SSRI. So imagine how very different things were. And I would say, in general, it has increased the number of potential approaches to therapeutic treatment in the work that we do with patients. When we didn't have as many medications or as many options, we relied often on psychotherapy as sort of all we could offer up in many cases. And today we can more commonly offer up a combination of psychotherapy and medication for a number of psychiatric disorders that we weren't able to do that in the past. So I do think there's some concern that the quick fix of using medications may at times overshadow or supersede the use of psychotherapy or addressing root causes of psychopathology. And there's obviously concern that we could become over-reliant on just using medications. But in actual practice, I've found that rather than detracting from psychosocial treatments and psychotherapies, that having more medications available will often keep patients in treatment who might otherwise not been able to take advantage of psychotherapy or participate in psychotherapy. So I think it's been a net plus. I certainly think it's wonderful that we have some new medications that are effective for treatments that when I was a resident we really just did not have much to offer. And again, as I said, we would rely or fall back to psychotherapy in many cases. So it's been, I'd say, a very positive and exciting and really revolutionary development. And it's also changed the way that we think about psychiatric illness in some ways, to see the effects that medications can have. It's made us think much more deeply about brain mechanisms that underlie the kinds of problems that patients come to us for. So it's helped to advance research as well.